Thank you, Commissioners, for the time today for this update. The metrics continue to improve overall. There continues to be a clear decline in new cases from week to week. You can see that on your screen, on your TV screens, that we've seen a marked decrease from the peak. Since January 18th, there has been a 67% drop in new cases per 100,000 per week. The current new case rate is 386 new cases per 100,000 per week. Additionally, the percent positivity continues to decline and has fallen from 19.6 last week to 15.5 this week. This is just over 4 percentage points drop in 1 week. Deaths, unfortunately, have increased. 21 new deaths were added to the dashboard. However, only 9 of those actually occurred in the last week. The remaining deaths occurred in weeks previous but were delayed in being reported. But this has caused our death rate to jump to 8 new cases per 100,000 per week because of those delays. As mentioned in previous weeks, it is likely that the death rate will fluctuate for several more days, even weeks, as deaths continue to be the most lagging of our indicators. Hospitalization and our hospitalization indicators are now both very favorable. Regarding what you're seeing in front of you now is regarding the entire Western North Carolina region. Hospitalizations and ICUs continue to decline. Within the Mission Health System, there has been a considerable drop in inpatient hospital beds occupied by COVID-19 in the last week. Last week, this indicator was 13.4% of the inpatient beds occupied with COVID-19. Now we are well below 10% at 8.8%. As of Monday, there were 104 total patients with COVID-19 within the Mission Health System. This is down from almost 196 patients about 3 weeks ago, which appears to be probably the peak for that indicator. ICU utilization continues to decline and is now well below 30%. We are around mid 25%. So though the colors in this metric table, the upper tier, are still in alert, we continue to be on a favorable trajectory in terms of the Omicron surge. As I have said previously, we have approached 2022, and once we entered into the new year, there are key thresholds that help us usher in a new chapter, new phase of the COVID-19 response. In particular, as vaccine, we have approximately 70% of our eligible population having received their primary series, what we know is fully vaccinated, and 56% of those individuals that have received full series have also received a third or booster dose. Vaccines continue to demonstrate effectiveness in preventing infection, severe illness, hospitalizations, and deaths. And in addition, evolving treatments and therapeutics continue to grow in supply and access. These treatments also help in reducing severe illness, hospitalizations, and deaths in individuals with higher risk. As anticipated, the pandemic landscape continues to change, and as such, the pandemic response evolves. With the face covering requirement expected to expire on Wednesday, February 16th, Public Health will now move to providing general public health recommendations at this time, given the rapid and expected to continue decline in cases, transmissions, and hospitalizations. Included in those public health recommendations will be strongly recommending that individuals continue to wear masks and face coverings in indoor public spaces. With or without a countywide face covering requirement, layered approaches continue to help reduce the spread. In addition, these measures work best when working together: vaccine, masking, testing, and staying home when sick. We've learned what things we can do individually to help protect ourselves, and as the surge dissipates, individuals can continue to utilize these effective tools while assessing their risk for exposure. I did want to talk a little bit more about the vaccine efforts. Vaccine and vaccination continues to be the priority tool for prevention. We currently have 72% of our eligible population having received at least one dose, and approaching that 70% of that eligible population receiving their full series. Vaccine uptake has slowed. I did mention that the last time, but we do continue to see countywide 200 to 300 net change in doses administered each week for the last few weeks. Each dose is helping to build a stronger shield of protection from COVID-19, especially against severe illness and hospitalization. I did want to share the hospitalization and ICU data that we have statewide. Vaccines are continuing to demonstrate their effectiveness in preventing infection, severe illness, and hospitalization and death. Almost 70%, if you look at the top, almost 70% of all hospitalizations are in unvaccinated, while the risk is much lower in those that are fully vaccinated and even lower in those who are fully vaccinated with a booster. This trend holds true for ICU utilization. We're just about 73% of ICU COVID-19 patients are unvaccinated, with far less ICU burden in those who are vaccinated and vaccinated with a booster. So for our community that's listening in, if you or someone you know wants their vaccine, you can still visit us at the health department at 40 Cox, Tuesday through Friday, 9 to 4. Buncombe County HHS will move forward with transitioning our 40 Cox, our smaller mass vax clinic, into the existing immunization clinic by the end of February, now that our less than 5-year-old vaccine authorization looks like it's going to be delayed for a couple months. Buncombe County HHS and Buncombe County Emergency Management have been bringing in the new year with several school-based initiatives for vaccine. Our event at Asheville Middle was the most attended, with over 90 doses administered, followed by TC Robertson, where we administered over 30 doses. And we closed out that series at North Buncombe High with vaccinating just under 10 individuals at that event. With the demand for mass vaccination community events waning, Buncombe County HHS will be looking toward more of that equity-focused vaccine events that I've been talking about for several weeks, partnering with existing and new community organizations with this shared mission. For example, I have on here that on the horizon we are currently planning an event in March with Healthier Together, YMCA, and the Mexican Consulate to hold a vaccine event. And as always, just want to take a moment to remind everyone that there are numerous vaccine providers in our community. Some of them are quite literally just down the road from you or right in your neighborhood, and you can visit the COVID-19 ncdhhs.gov/vaccine site, or just simply Google North Carolina, find my spot, find my shot, to find a vaccine provider near you. And as I wrap up today, there are some key messages for the community to remember. Again, we are experiencing a rapid decline in cases, transmission, and hospitalizations. It appears that we are seeing that decline in that Omicron curve and that Omicron surge. As the surge continues to decline, we are now moving into strongly recommending individuals continue to wear masks in indoor public spaces. Again, if you are exposed to a known positive, consider getting tested. If you have symptoms, stay home, seek provider or community testing. If you are infected and are high risk for severe illness, talk to your provider or visit the Find Treatment website. And vaccines, again, just want to close out by saying vaccines are working to prevent severe illness, hospitalizations, and death. Please consider getting the dose that you are missing today, whether that's your first, your second, or your booster. And I wanted to thank you all very much for your time today and welcome any questions.
Thank you, Stacy. I have a question. So looking at the data you gave us, so only 56% of the fully vaccinated have received their the third booster, or the booster, which is the third. And when I look at the hospitalizations and the ICU numbers, if you've had the booster, I mean, it is dramatically decreasing your chances of ending up in the hospital or the ICU. And so, and it seems like that group of people, right, they've already had vaccines. So it seems likely to me that they would be open to having the third. And so I'm wondering, is there anything that you're seeing or you're thinking about that we can really do with outreach to that group to increase their uptake of the booster because clearly we're seeing that helps.
Absolutely. So thanks for the question and the inquiry. So I think, one, as I said a couple weeks ago too, I do think we are seeing that vaccine uptake wane a little bit. I do think some of that was that we had the holidays, folks were still in that holiday mode, and just getting back on track. So lots of competing interest. So doing a lot of our messaging around Give Your New Year a Boost, helping folks understand that the importance of boosters, and actually doing some community group types of talks around just COVID in general, but definitely hitting that it's time to get a booster if you're eligible. We've had, not everybody's going to be eligible for a booster yet, so we want folks to remember that as you approach your eligibility, there are several providers in our community. So we continue to, and will continue, that will be sort of our goal for 2022 as we approach 2022 and came into it, was really about our whole campaign around Boost, Give Your New Year a Boost. So hopefully continuing to do that with our social media, our new visuals, the revamping of our 3 Ws Bear, and some community-based discussions or presentations to help with that. Mm-hmm.
I guess kind of related to that. I mean, I realize what we do in one community, we can't establish the language for how we talk about all this stuff as a country, right? I mean, there's sort of the national terminology that's being used around this. But, I mean, in a way, to Commissioner Wells' point, I mean, in a way, it almost seems like it would be maybe preferable if the language around this word, like, you need to have 3 shots if you want to be considered fully vaccinated, right? We talk about people being fully vaccinated, but in the reality is that, at this point in the development of the medical treatments, they're really not fully vaccinated. In that, I think there's this perception among even a lot of folks who've been vaccinated that it's kind of this nice to have, but you don't need to have it kind of thing if you've had the first 2 shots. Whereas, as we've learned more about this, we see what a really significant additional layer of protection the 3rd shot does provide. So anyway, again, I know we're not setting the national narrative around how these things get discussed, but it really is, it seems so important that folks go ahead and get the 3rd shot.
Thanks for that comment. Absolutely. It is very important that if you are eligible for your booster, that we are seeing time and time again, vaccine is demonstrating its effectiveness. You're right, we don't get to control sort of like what's called fully vaccinated right now. That language is still as is for the 2 series, although there has been a shift in that language, at least at the federal level with the CDC, that now to more talk about up to date. Are you up to date with your COVID-19 vaccine? That would be much more encompassing of not only did you get your full series, and if you're eligible, did you get your booster?
Parker, do you have a question?
Thank you, Stacey. I had 2 questions from constituents that I wanted to ask you. One around masks and one around children and vaccines. I guess, as I think we all know, the federal government has provided some free N95 masks through various pharmacies and those kinds of locations. Someone was asking me if there's a way, without calling every pharmacy in Asheville and asking them, is there a way to look up what locations people can go to get those federally funded free masks?
That's a great question. I will get back to you on that one. I do not know off the top of my head if there is a single source where you can find that.
Okay. And then my other question, around the disappointing news around the 0 to 4-year-old vaccine situation. I think when we thought it was coming, someone was asking me about, you know, where people can go to get those shots. And I guess I just wanted to ask is it your expectation that most people would go to a pediatrician's office to get that vaccine? Would our health department be involved in giving out those vaccines? What's kind of the general plan for when that does come?
Sure, thanks for that question, because as we were anticipating that happening, we already started planning not only at a state level, but at a local level. And that I can tell you that the anticipated plan, if it doesn't change from what we were expecting before it got delayed, would be that yes, lots of vaccine going to what we call medical homes or pediatricians, where you've already got a trusted relationship, where your child already knows their provider, and also for local health departments to be a primary place for vaccination, mainly because in the more recent weeks, our retail pharmacies have been doing lots of vaccinations. But the PrEP Act doesn't allow for the pharmacist to vaccinate anyone younger than 3. So 3 and younger. So we're going to miss a chunk of that population. And so we do anticipate that local health departments around the state are going to act as a safety net when the 0 to 4 are eligible. And for us, we had delayed our transition of the 40 Cox smaller mass vax clinic in anticipation of the 0 to 4, and now that we're hearing that delay and that it's likely probably April, we will go ahead and transition that, and then as we approach that eligibility, likely plan either a special event or some type of special setup to help meet that need.
Thank you.
Stacey, I want to follow up on the slide that you showed of hospitalizations for unvaccinated folks. I can see on the NCDHHS COVID dashboard that 4% of hospitalizations are under 17. Do we have any kind of breakdown on the under 4-year-olds that can't be vaccinated, and are they being hospitalized? Are we seeing any kind of correlation with age and vaccination status?
Thanks for that question. I don't have that data with me today, but happy to pull that for you as much as I can at a local level, and then at least at the state level so you can see that. We'll be glad to share that with you.
Thanks, Stacey. No rush. I appreciate it.
All right, if there's no other questions, Stacey, thank you for the update and for all the good work from all the folks on your team. We really appreciate it. Commissioners, related to this, I was reminded for the regular meeting this evening, we do have a discussion of the indoor mask policy on our agenda. As Stacey mentioned, it is currently scheduled to expire on February the 16th. So as part of that, we should also discuss the local emergency order that was put into place. It doesn't cover just the indoor mask policy. It's sort of larger than that. But we should, if there's consensus to agree to that, we should have a discussion about that as part of our discussion of the indoor mask policy too, because they're kind of related. And Avril, do the staff have any language that you would have ready or prepared, Mr. Frew, related to that?
I didn't get this to you, Mr. Chairman, before the meeting, but if the board does decide to let the local mandate expire at noon tomorrow, then it would be in order to add an agenda item to specifically rescind the local state of emergency. That was just activating the emergency action plan, so it'd just simply be a motion to, if the board decides to rescind the emergency action plan in the local state of emergency.
Okay, so we could adopt that language that would rescind the local emergency declaration.
Yes, sir.
Okay. Is there consensus to include that in the discussion this evening? Great. Thank you. And there was one other question that someone asked me. So assuming that the indoor mask policy expires on February 16th, that still allows individual businesses and organizations who wish to continue to have an indoor mask requirement for their own facilities to make that choice. Is that correct?
That is correct.
Okay. I got a phone call from Judge Alan Thornburg, who just wanted us to mention that the courts remain supportive of having an indoor mask policy for the courts. They feel like it's very important. You know, when folks have to report to court, it's oftentimes not something that they have the choice of whether to do or not. They're required to do so. And so he shared that the judges believe that it's, you know, first of all, very important to try to do everything we can to keep COVID out of the detention facilities because it's a confined, close quarters environment. And because, again, people, it's not a place where people completely have the voluntary choice of whether to appear there or not. So they feel like it's important for the time being to keep that policy in place and wanted us to just share that that's their intent. And I want to make sure we're not going to adopt anything that would be inconsistent with allowing them to make that choice, just as any individual business owner could continue to do so within their own private property if they choose to do so.
And I would add, sir, not just business owners, but offices or government offices as well, because we would want to keep it in place in some of our locations as well. So give us the opportunity to just not, it would be for the public that they have the option, but individually we can set that policy for our own locations.
Okay, and are the staff prepared to share some information about what facilities they would be planning to do that in at this time or at the meeting this evening?
Yes, we were thinking a 5 o'clock conversation, but specifically our libraries will be one that we want to make sure, because that is an in and out conversation on a daily basis, and some of our public health locations. So we want to make sure that we keep those in place in those locations.
Okay, so yeah, let's please just review that at the meeting this evening so that we make sure the public is aware of, you know, what to expect going forward. Okay, all right, thank you, Stacy. All right, next up,